So, Dr. Boike, I think I had you touch on a question a few minutes ago about how there are several different PET scan reagents, and I know they do differ. So, my question is does one reagent have a superiority to the other, or they have different uses in different situations?
Yeah. So that's a great question, and I think there's a lot of things that we'll be learning about and finding the answer to. And just to Dr. Hafron's point, we've done some trials in the U.S. We understand some things about these agents. The one that I always look at was a trial that was done looking at how to use these PET scans and make decisions off of them, because there's a phenomenon I always like to talk about called the Will Rogers phenomenon, right? And so that's where people from Oklahoma moved to California, and both states got smarter. But this is the phenomenon where a technology is introduced and everybody does better because you have better technology and you understand more. And so what we've seen in various clinical trials, one that was done mostly at Emory or led by Emory in Atlanta, was that when PET scans were used, better treatment decisions were made, either to treat the lymph nodes with radiation or to not treat them, or to treat the prostate bed or to not treat it. So we're learning how to use these PET scans, which is a big thing. We're also learning what reagents might be best in which situations. And there's a lot of considerations for what reagents might be best. A big one is availability. So FDA approval, payer coverage, whether it's made with a generator or a cyclotron, how far it can be shipped. And so you might and these are just all practical considerations. So you might have something that's a fluorine base, which we know how to deal with, we know how to ship it, we know how to move it around. That would be Pylarify, and we can make that available to a lot of patients. So access is really good, and it's a PSMA-based tracer, which is really good. They're looking at things like copper. Gallium, unfortunately, has a generator, so it's limited how many patients it can do. But they're looking at strategies to put them other places and stuff like that. Now, with all that said, some of these tracers are saying, less uptake in the kidneys, more, less urinary excretion as we're looking for, small lesions in the prostate bed after surgery, or, lymph nodes that might be next to the bladder. And so those, I think, we'll learn more as we get our hands on more of these PET scans and we get more of these FDA approved. But there will be several approved tracers in this market.
So you alluded to calling this other scan a PSMA scan. What does PSMA really stand for, and why is that important? What does that have to do with all of this that we're talking about?
Yeah. So PSMA is prostate-specific membrane antigen. And so that's a receptor that sits on the surface of the prostate cancer cells. It's not entirely prostate-specific. It can be found in the salivary glands, and it can be found in other cancers like hepatocellular cancer or lung cancer. But it is the most specific thing we have right now. And we're looking for things in other cancers where we can image them functionally just like that. So PSMA, prostate-specific membrane antigen, shows us the surface or the cell surface of those prostate cancers.